Hi, I am Sanda Valcu-Pinkerton, and I am a myofunctional therapist working with Dr. Zaghi during the Frenuloplasties. And I am here to share with you our post-operative instructions. It is normal in the first days to experience minor bloody oozing. However, if that is going to happen, we recommend to use the gauze and just to put under the tongue and to apply pressure. If it happens to be more than just a couple of drops, please contact our office for more information in what to do about it. But please keep in mind, it is really within normal limits to have a little bit of bleeding in the first 2 days. You'll be provided with 2% viscous lidocaine and gauze applicators. What we advise you to do is to soak the gauze into a teaspoon of lidocaine and just to apply on the surgical side. In order, to keep it nice and clean, just change it as many times as you feel like is necessary. We strongly recommend to have that gauze inside of your mouth for 1 to 2 days, especially during the night time. And with gauze, you can change it as you need it, but just please keep in mind it's very good to have it for the first 24 to 48 hours inside of your mouth at the surgical site. We recommend Tylenol or ibuprofen, and for some people, if they prefer, Dr. Zaghi will prescribe pain medication. For the patient taking already pain medication for chronic illness or pain, we do strongly recommend for them to ask us about our in-house outstanding pharmacist, which will be able to sort out what kind of medication will suit the best their needs for this procedure and aftercare. We use dissolvable sutures. It takes anywhere between 4 to 10 days to dissolve by themselves, so there is no need for you to come back to have them removed. However, if one of the sutures will come out sooner than 4 days, please don't panic. It is still considered normal, and they will come off based on the fact if your tongue is touching the edge of the teeth. The sutures are coming out, then we encourage you to brush the surgical site using an extra soft toothbrush, which we provide in the post-care kit. We recommend rinsing with salty water or alcohol-free mouthwashes as many times as you desire, but after you eat, that's an excellent idea. That's a perfect time. And also a great choice it is using a colloidal silver spray on the surgical site. Myofunctional therapy exercises are extremely important, so please follow your myofunctional therapist advice in terms of exercises and stretches before and after surgery. We like to recommend waggle flap, waggle spot, capes, tongue pops, flat tongue, also known as a puppy tongue, skinny tongue, also known as snake or pointy tongue, and taco. We wish you the best of healing, and please feel free to reach out to us if you have any questions.